Okay, good afternoon, doctors. Welcome to this afternoon's program, How to Get 15 New Injury Patients from Medical Referrals. All right, before I start, I just want to check in to make sure that my staff can hear me. I can hear you great. Okay, perfect. Thank you. All right, so I'm going to get started. How to do this is actually pretty simple. And what I'm going to first talk about, what I'm going to first say is the injury market's a lot like Bitcoin was in 2016. For some of us who saw the opportunity of Bitcoin, we took advantage of it and we did very, very well in it and are still doing well in it. For those that are now looking at it saying, wow, Bitcoin back when I could buy it at 10 cents or $1 would have been a good thing to buy, would have been a good thing to buy into. You're looking at it now going, hey, I wish I was in this more. I'm going to tell you that the injury market, the current injury market is a lot like this. And it's a lot like it was in 2016 because the injury market is changing, and it's changing quite a lot, and it's changing a bit rapidly. So for those of you that don't know me, because we're getting a lot more doctors on our programs with Spinal Kinetics that don't know me, my name is Dr. Kronk. I'm the founder of the Smart Injury Help Program, Smart Injury Doctors, Smart Injury Lawyers Program. And I'm getting more and more known for saying today's spinal soft tissue injuries are the #1 cause of pain and disability in the world today. This has resulted from very poor diagnostic procedures that are not standardized. This, of course, does not have to be our tomorrow. So what I thought I would do first today is just throw a couple slides up, who I am, what I am. Yes, right now you're listening to me. I'm the Director of Education for Spinal Kinetics. Spinal Kinetics is a national spinal ligament testing company. It's the only national spinal ligament testing company in the country that use board-certified medical radiologists to perform its services. I was a treating doctor of chiropractic for over 17 years. I developed 2 national ligament testing companies. Spinal Kinetics is the second that I'm involved with, and that's the one that you're on a webinar with today. I helped develop the technology that the radiologists at Spinal Kinetics use to do our studies called CRMA, which is the trademark of Spinal Kinetics. Trained a lot of radiologists how to use it. I've delivered more webinars on spinal ligament injuries than probably anyone in the country. Again, I've delivered programs to attorneys, insurance defense firms. I developed the first online doctors training program specifically for spinal ligament injury specialists. I'm on the board of directors of a company called Spine Injury Solutions. I'm on the advisory board of the National Pain Foundation. I have a degree in law with special emphasis on personal injury. And there's really no one in the market today that's done more in this area of ligament injuries. I've also published research, co-published research. That's with Spinal Kinetics owner and founder Stephen Brownstein. Myself, I've published 2 opinion papers. This is one of them. Simple spinal sprains are not all that simple, and the other one was spinal pain. Maybe it's not all in your head. So I have a lot of experience in this injury market. So right now, today's program, I go very quickly with programs. If you sign on and you log in, and what I want to do is really validate the fact that I know you're busy. So I am going to get right to the point. First of all, if you get 15 new injury patients from medical doctors, let's take a look at what that really is, because 1 new injury patient can generate the services of 5 regular patients nationally. So when you take a look at the national averages on injury patients versus regular patients, for every 1 injury patient, you need 5 regular patients to generate the same amount of services. So if I'm talking about 15 new injury patients from medical referrals, I'm really talking about 75 new regular patients. So that's the comparison. So I want you to just get a comparison here for a second. So for every 100 new regular patients nationally across the country for chiropractic, at least, it's about 120,000 in services. Now you are competing with companies like the Joint and other companies. You're competing on price. They'll do a $69 exam and 4 adjustments for that same $69, and then they'll charge $10 for every adjustment after that. That's kind of what you're competing against in that market. Now, for 75 regular new patients, then you generate an average of 90,000 in services. So instead of the 75 new patients, that all can be done with 15 new injury patients. So I kind of want to put that in perspective as to just how significant of a change this can be. I mean, for every one injury patient, you have to see 5 other patients. You have to talk to them about a treatment plan, finances, compliance with your program, why they need to do all of that goes into it. So I personally was a doctor that really enjoyed working on injury patients, and there was a reason why. But in order to do this, your primary focus has to be on injuries. Now, it doesn't mean you have to leave your primary focus of whatever else you have in your practice, but what I'm saying is you can't do this without a primary focus on injuries and becoming really good at injuries, because top professionals, top medical professionals, that's what they're looking for. That's what they want to refer into. They want to refer into stellar professional doctors that really know what they're doing with these injuries. So the nice thing about it, again, with the injury patient, it's much higher reimbursement, 1 for 5. No patient finances to discuss, and less injury limitations on care, which improves your ability to get great results. So the nice thing is that there's no patient finances to discuss and no insurance limitations on the care. So basically, with an injury patient, the nice thing, the reason why I enjoyed working with injury patients so much is that you actually get to do what you want to do to get the patient well. In the injury market, if you can get injured patients well, you pretty much do whatever you want to. Because in the market, they're not getting the patients well in general. And I'll point that out and show you why. Now, the beauty of that is when you can have the patient do whatever you want them to do, you can get great results, which means more patient referrals. So the referrals can come from satisfied patients. The referrals can come from medical doctors. The referrals can come from attorneys. And all you need to do in order to get great medical referrals is 2 things well. You have to accurately diagnose the patient's injuries. And that's something that's not being done on a regular basis in the market today. And you have to quickly and effectively treat the injuries to a superior result, which a lot of you are very good at doing. Now, there's also, if you want to really excel in the market, there's 2 other things that you're going to do well. But we're not going to talk about those 2 things today. You have to document in a way that allows the patient access to any benefits they may be entitled to, and you've got to be able to market. So what we're going to focus on today is these 2: accurately diagnose, quickly and effectively treat. How big is the injury market? It's huge. The injury market is an $820 billion market in 2013. Just to kind of put that in perspective, the defense budget for the United States was probably around $570 billion that year. So this market dwarfs what we spend in defense spending. Every 2 seconds, there's a home-related injury. So if you look, there's home-related injuries, public-related injuries, motor vehicle accident injuries, and work accident injuries. So what's public? Public is anything that happens outside the home that didn't occur in a motor vehicle or didn't occur at work. So if it occurred at your business, that's a public injury. If it occurred at a boat landing, that's a public injury. If it occurred in a park, that's a public injury. If it occurred at home, obviously that's a home injury. Every 2 seconds, there's a home-related injury. Every 7 seconds, there's an injury in an automobile accident. Every 7 seconds, there's a work-related injury. Every day in America, 108,000 Americans are injured every single day. They generate over 252,000 medical visits. And this does not include visits to chiropractors or physical therapists. So the estimate of the annual direct medical costs for all back-related conditions, that's back and neck-related conditions for medical, is $253 billion. So it's a huge market. Low back, lumbar, and cervical neck pain are among the most common medical conditions requiring medical care and affecting an individual's ability to work and manage their daily activities of life. That comes from the Bone and Joint Burden Report. So general medical doctors have a very difficult time with the diagnosis and treatment of this condition. They actually struggle with it quite significantly. And to give you an example of that, I'm just going to pull up. This is the American Family Journal. This is a medical journal, very respected medical journal, where medical doctors go to get their information. This is called Non-Specific Low Back Pain and Return to Work. These are guidelines for medical doctors in low back injuries. Now, it could be low back, it could be neck injuries. It really doesn't matter. So the risk factors. Under this report, it says the cause of low back pain cannot be clearly identified in 90% of the patients. Now, that's the same with neck. So they go on to say, now that doctors should be very, very significant for you. A lot of doctors that I talk to just hear this and it kind of goes in and goes out, and you don't really see the market opportunity there. 90% of what they see, they don't know what is the problem. So what they say is some physical demands, including manual lifting. Remember, these are guidelines for medical doctors on return to work parameters in work-related injuries. Some demands, including manual lifting, bending, twisting, and whole body vibration, are associated with an increased likelihood of low back pain. It should be noted that the association is not equivalent to causation. However, there is strong evidence that personal and occupational psychosocial variables play a more important role than spinal pathology or the physical demands of the job. So basically what they're saying is that we don't know what the underlying pathology is, but since we don't know what it is, we are assuming that the psychosocial variables play a much more important role than does the underlying cause, physical cause, which is incorrect. And that's what's caused the market to go so excessively high. So just to give you another point here, they also come out and say the management of low back pain and determining the patient's safe return to work are common issues encountered by family physicians. Challenges include unfamiliarity with the patient's job demands, complex workers' compensation systems, and a vast array of diagnostic and therapeutic interventions with questionable effectiveness and value. So not only say that 90%, and if you're a medical doctor online today and you're listening to this program, I'm not attacking medicine in any way. I think medicine is incredible right now because at least they're honest. The other professions are not honest in the fact that they do not standardly come up with an accurate diagnosis of exactly what's causing the patient's problem. But that's the easiest thing in the world to do. And that's what makes the practitioner so incredibly valuable and so able to actually go in and get medical referrals or attorney referrals or anything else. Now, this is William Morris. He's the top researcher in the world for intersegmental motion pressures. In his book, which I'll show you the title of in just a second, he says that it has been estimated that a precise diagnosis is unknown in 80 to 90% of disabling low back disabilities. So those are doctors that are actually working with patients and they don't know the actual physical cause of the problem. So he goes on further to state, sorry, I only have one slide. So his slide or his book is called The Functional Back System. And if you have any questions on that, you just go ahead and contact Spinal Kinetics and I'll let somebody at the office know there. The exact title, you can go out and buy it on Amazon. It's William S. Morris. And it's probably the best book in the world on injuries, specifically injuries to the low back, but it correlates to injuries to the neck. So almost 40%, no matter what statistic you want to look at, and this one we're just looking at non-fatal injuries involving days away for firefighters. The majority of injuries, no matter what injury category you look at, are sprains and strains. Sprain is a ligament injury. Strain is a muscle injury. A muscle injury is usually not anywhere near as bad as a ligament injury. So more than almost 40% of all injuries include soft tissue injuries to the spine. So the beautiful thing is, now it doesn't matter if you're a medical doctor and you want to receive referrals from chiropractors, you can go out and do this. You can do the same thing that I've taught chiropractors to go out and teach medical doctors. Medical doctors today could go out and teach chiropractors about spinal instability and how they're actually diagnosed. So the beautiful part here is that this slide is a slide of the common symptoms associated with a spinal ligament injury. So you're going to see just about every condition that most patients walk into your office with is on this list. So remember, diagnosis is you work the symptom to the most simple physical condition that could be causing it, and that's ligament conditions today. So ligaments, for just a short review, there's only 23 intervertebral discs in a human spine. There's over 220 specialized ligaments. So about 10% of the structure of ligaments in the spine is disc, which means that MRI is good for about 10% of the ligamentous structure, which we know today. So when I say a doctor has to be able to do a really good workup, all the doctor has to be able to do is do it in the consult. They're doing simple pain diagrams, and you simply correlate to the level that could be problematic. You then go into your examination procedures. You do motor and sensory testing to test the different nerve levels. And the different nerve levels point you right to the actual area of the spine that may be problematic. Then you take great stress x-rays. And when I say great stress x-rays, x-rays where you can actually see the vertebral bodies completely. If you look at these x-rays, you can see every single vertebral body here. If you're taking an A to P open mouth, you can see both lateral masses to see if there's a lateral mass slip, in which case there is here, right? You look at the bodies of the vertebra and you can see that. You don't see artifacts covering anything. So you take good stress x-rays. Then you send them in to a company like Spinal Kinetics. I'm going to tell you, in the injury market, you definitely want to find an unbiased third party to do it. And I'll explain to you why in just a second, but it's the same for medical referrals. So CRMA is computerized radiographic mensuration analysis. CRMA is the trademark term of Spinal Kinetics. What it means is it provides a functional analysis of the spinal ligaments. It provides a motion study, an intersegmental motion study. It's really easy. You look at that intersegmental motion study and you go, where's the location of the ligament damage? Well, it's right here. Now, in this case, this is grade 2 sprain findings. That's grade 3 sprain findings. And what this provides you with is a really high level of professionalism. When you're going to do the A to P open mouths, you actually want to get good views where you can see both the lateral mass of C2 and C1 clearly. If we at Spinal Kinetics cannot see your structures, we cannot measure them. And if you send them in, we assume that you've looked at them and couldn't see them and don't want the study run. So then you just simply clinically correlate. And it's just that easy. This correlates to why you would have headaches in every consensus possible. So in other words, medical doctors, osteopaths, chiropractors, physical therapists have all said if you have problems of ligament damage in the cranial cervical junction, that's the most common symptom you're going to have. If you have pain in the axial portion of the spine and you actually have motor, sensory, and abnormal findings here. Now, well, I haven't even talked about the fact that these two are rateable under the AMA guides, but this actually correlates with exactly why you have the neck pain. And now you need to get to work actually correcting that. Now, the other thing I'm going to tell you is when you have this right here, new research, and it's unfortunate we have to wait for research because I've been saying this for years, where you have the most excessive motion in the spine. You now have research that says, especially in the mid-cervical spine, that if you have that in extension, you also have a high probability of having what? A disc herniation. And that disc herniation now, if there, you have one of the most serious soft tissue injuries to the spine itself, and you have got to have a provider that knows what to do with that. Now, the medical doctors don't necessarily know what to do with that unless they're specialized. So I have medical doctors online today that are specialized. I'm not talking about that. I'm talking about the general medical provider, the 800,000 medical providers, the 264,000 general practitioners. That's what I'm talking about. They don't know that's there. So it becomes really, really easy to actually go to these centers and explain to them that this is what you can do as a provider. To explain to them that what you do is you specialize in spinal instability. You have to remember, these when patients come in and they have back pain or they have neck pain, oftentimes these urgent care centers or these there's other care centers not called urgent care. I can't think of the name of them right now, but these medical centers actually, the majority of them don't treat. They don't have any physical therapy. They don't have any treatment. Or if they're an outpatient emergency room, they don't have anybody that treats. So they have to have a place to refer these patients to. Right now, they are referring these patients somewhere. What makes it very easy is to go in and start to communicate with them on why they should communicate, why they should be sending them to you. Now, here's the thing, doctors, that I want you to understand. When I said that this is a lot like Bitcoin, when I said the injury market is a lot like Bitcoin, here are the people that are going to mine this market. And they're going to win like Bitcoin. There's 4 things that you have to be able to do. 1, you have to accurately diagnose the condition. That's where we fall into spinal kinetics. 2, you have to quickly treat the condition. Now, that doesn't happen a lot of times because you're not known in your market. So you don't get these patients. A lot of patients that go to the urgent care center go to the urgent care center simply because they can get in. They can't get in with their primary care providers. They can't get in with any medical specialists. Sometimes that can take weeks or months, right? So a lot of people use these urgent care centers to go in and at least find out, okay, just as an auto accident, am I hurt badly? I lifted at work, am I hurt badly? And then they refer the patient from there. So these are great primary sources of referrals, and you can get in and you would be amazed at how many injury patients these places are seeing, but you don't have a relationship with them. Now, your relationship with them is as a spinal instability specialist, or your focus is on, you can't say specialist because you're in some state, your focus is on spinal instability, and that's what you focus on, that's what you treat, so that they understand. Now, I'm going to tell you also that it's much easier for you to go in when you're using a CRMA from Spinal Kinetics. In other words, you're using a report, it's signed off by board certified medical radiologists, unbiased third party. It's great for medical referrals. Now, just so you know, at Spinal Kinetics, on all CRMA studies are reviewed by 2 different licensed professionals. Ratables get a 3rd look, sometimes a 4th look. Anything that's unusual gets a 3rd and sometimes a 4th look. That means quality control doctors, which is incredible in the injury market in deposition. That kind of quality control is not in the market anywhere. That's what makes Spinal Kinetics Spinal Kinetics. That's what makes us unique. Now, you cannot do this in your own private practice with softwares. You can't do that. Plus, there can be unique deposition problems when you do it yourself that can seriously cut down your referrals. They'll seriously cut down your medical referrals, your attorney referrals, and in some cases, your patient referrals. So that's, if you want to go out and you want to start to go after medical services, then you have to have something unique. Spinal Kinetics helps you to become unique. And again, we have quality control second to none. So those of you that have never used Spinal Kinetics and would like to start to use Spinal Kinetics for your injury workups, you just go to thespinalkinetics.com and you put in either a query, it says right here, start, learn how to use CRMA ligament testing. And you basically just hit that button and start. Or you call 877-508-9729. Now, I know that, I know that that was brief, and I'm going to go here. I know that that was brief, but I'm going to open it up now to Q&A. Any questions and answers on, okay, what would you do or what would you need to do in order to get referrals from medical providers? And you know, it could be express care centers. One of my members of my team actually said express care centers in grocery stores and Walmarts. Same thing. It's the exact same thing. So the question is, do you have any questions on how you can do this? Basically, you go out and you start to talk to the providers there. You get access, you call and set up an appointment. You explain to them what makes you unique and what do they do with these patients. And you ask a lot of questions when you're in there. What do they do with these patients? Where are they sending them to currently? And you establish a relationship. But it's easier to establish a relationship if you know that you are the best that there is. See, a lot of providers have a difficulty doing this because they don't think they're that good at what they do. So they withhold themselves from going out and getting this business. They withhold themselves from going out and telling everybody on the sun, moon, and stars that they're the best in their area. And if you truly are the best in your area and you are holding back, why hold back? Why hold back at all? Okay, here's a doctor says, problem, a lot of urgent care centers in areas are corporate owned and will only refer to their corporate specialists. Okay, that's true. That is true. They're corporate specialists. So who are their corporate specialists? Their corporate specialists are medical doctors, and their corporate specialists are medical doctors who are connected. Now, here's what I'm going to say to you. Here's what I'm going to say to you. Is there market competition? Yes. Is there market competition? Yes. Now, and that means that you have somewhat of a barrier to entrance. Now, I always looked at that and said, that's beautiful, because if there's a high barrier to entrance, that means not very many doctors will enter. So a lot of doctors will look at it, they'll hear that problem. A lot of urgent care centers cooperate with will only refer to their corporate specialists. So somebody said that, and so now they won't approach. I'm telling you that when you have the best spinal ligament treatment center in your area, the more you approach, the more you approach, the more you communicate, the more you communicate, the more you communicate, then you will be asked. I mean, I haven't even talked about what the hospital systems are looking at doing right now. In certain areas, I showed you a slide, it's $253 billion industry for medicine. And medicine is looking to incorporate practitioners right in. But if, let's say I got you on the board of a local hospital meeting and they want to interview you as to why you should be their spinal injury expert for soft tissue injuries, what are you going to say to them? You better have somewhat of a presentation that shows how you understand scientifically exactly how to diagnose these conditions objectively, and know more than anybody in your local area. That's the key. All right, it says, when you find an instability at certain spinal element, I assume you don't adjust it. At what degree can you adjust it? Okay, so Dan, let me pull something up once. That's a great question, doctor, but let's just pull something up once. I just had this question come up. Good, so we're just gonna pull something. This is a September 2010 Chiropractic Impact Report, and it's written by Dan Murphy. And at the end of it, it says, by Dan Murphy, and I'm assuming that all of you are very familiar with him. All right, let me get out of here. Spinal clinical instability is a concept that is well understood by chiropractors. All spinal trauma patients, especially whiplash trauma patients, should be assessed for clinical instability. All of them, doctor. Not some of them, all of them. For decades, this assessment is done primarily by using maximum flexion and extension lateral cervical x-rays for decades. And this service is routinely performed on spinal trauma patients by chiropractors. For clinical reasons, some patients may need additional assessment. Okay, but that assessment is to actually improve. The key concept from Dr. Slosberg is that chiropractic spinal adjusting can improve segmental instability as a consequence of activating the multifidus muscle and other actions that we now find. So when you say, when you give me the clinical question of, let me go to the question. When you find an instability at a certain spinal level, I assume you don't adjust it. I adjusted it for years, 17 years of private practice, and I know that they're being adjusted routinely unless every patient in the country that's receiving adjustments is screened with flexion extension x-rays. You don't know if you're adjusting an instability. You don't. And by the way, clinical instability means excessive motion plus motor sensory or pain problem associated at that level. So what we're here to do is, what I've been here as a director of education for Spinal Kinetics, is to bring the awareness to the fact that these ligament injuries can be very accurately assessed so that proper treatment protocols can be done. One of the most beneficial treatment protocols there are the initiation of spinal manipulation or spinal adjusting, whether it's done by a chiropractor, a physical therapist, an osteopath, a medical doctor. That has been shown to be highly successful for the treatment of that condition. Does that answer your question? Okay, all right, any other questions? Great question, that's a good question. And that's a question that a lot of chiropractors have. But here's the thing, if you're questioning that and you're questioning how your treatment treats a spinal instability, then getting medical referrals is going to be a challenge. It really is, because you have to know this. You have to know this cold. You have to know cold that the ligaments actually damage the mechanoreceptors. And when you damage the mechanoreceptors, you pull the mechanoreceptors offline. Spinal adjusting, no matter who delivers it, if delivered correctly, brings back on the mechanoreceptors, and the mechanoreceptors are what coordinate the neuromuscular control centers. So they coordinate the muscles of when to fire and when not to fire. So if they're offline, the instability is significantly worse. What is the usual length of time for treating these patients? Well, it depends on the severity of the condition. If you're talking a mild sprain, they should be resolved in 6 weeks. If you're talking about a more moderate sprain, 40% of them are done within 3 months, 60% are not, according to research out of Australia and national guidelines that were published in Australia. So, you know, what's the healing time of a ligament? It's over 2 years, complete healing of a ligament injury, 3 phases of healing with it. Well published, well documented. What paper is by Dr. Murphy? The paper that you get at the Spinal Kinetics website, there's a paper that just where Dan Murphy goes over spinal instability and Dr. Slosberg's information. It's just one article. There's many articles on spinal instability and spinal adjustments if you're looking for them. But that basically was, you can get that in the Spinal Kinetics back office. But this was the paper. We're looking at it right here. It's on your screen. You could also, I think, Google, let's come up to it, September 2010 Chiropractic Impact Report, Cervical Spine Injury and Clinical Instability. So it's that paper. So if you Google that right now, you should be able to pull it up. Okay, any other questions? Now, okay, one of the questions is, how do I do this, and do I have materials? Yeah. I mean, one of the biggest challenges of basically going into, oh, Scott Rosa says hi. Tell him hi. Fantastic. Um, one of the challenges that I have as director of education of a spinal ligament testing company is I can't do that much educating. So I did create a program, and you will definitely see this program this year. I don't think, if you're a chiropractor, you won't miss this program. But it's called the Smart Injury Doctors Training Program, and it includes a marketing program. And for those of you that have interest, I don't have this was the web link that I have right now. You can go watch a webinar where I explain this whole entire program. I explain the cost of it, and the cost right now is so insignificant compared to probably what it will cost. But this is where you would go. So you just write this down or take a screen capture of it and go to that. The walk-in clinics and emergency rooms in my area refer patients to their primary care physicians. How do you break into that relationship when the primary care physician is part of the walk-in clinic? Well, again, doctor, the primary care physician doesn't treat the patient. If they treat the patient, they treat the patients with some drugs or anti-inflammatories, but they really don't treat the patient. So when they're informed, right now in the work comp market, research has come out that says for every day that the worker does not report their injury, there's a 3% increase in the cost of the claim. Now, those increases in costs are significant. That's a significant, say 3% good today, 6% tomorrow, 9%. 4 days we're at 12%. So if I got something that's going to cost me $20,000, it just cost me $2,400 because I waited 4 days. All right, so these costs can get very, very significant. You wait 30 days, you pretty much have doubled the cost. So what the biggest problem that patients have in the injury market and in the ligament injury market is a delay in proper treatment. And a delay in proper treatment seriously increases the risk that the patient will never fully recover. I mean, you can't take a badly damaged fracture patient and have them wait 6 weeks to get proper care on the fracture. The fracture is going to start to heal in a bad way. It's no different in the spinal ligament area. The quicker that you can shut off the pain, the better the chance the patient has that the pain will shut off. So delays are what you're going to go and explain to them about. I wrote a report at smartinjuryradiology.com about the 3 biggest pitfalls with MRI and spinal ligament injury diagnosis, because that's what the medical doctors, that's what they know. They know MRI. So it's a free report that you can give to the medical doctors. And I train doctors how to give these to the medical doctors or to the attorneys or anybody else that needs to know about the difference between MRI and stress testing, stress x-ray testing. Big differences. Things you pick up on stress x-ray that you can't pick up on MRI in general. And there are big differences. So you know that's how you start to break into them. And I hope that answers your question. I mean, as good as I can on this webinar format. Does spinal, if it doesn't, just give me another query question. Does spinal decompression along with adjustments improve outcomes? Again, doctor, you got to tell me what I mean, are you talking about a completely torn up cranial cervical junction with a completely torn up mid-cervical spine translation findings for excessive motion and disc herniation all at the same time? Are you talking about grade 2, grade 3? I mean, you got to give me a little bit more of what you're talking about. But here's what I'm going to tell you. Here's the beautiful thing that I'm going to tell you. If you have spinal decompression unit, then you can actually be the one that shows that with proper diagnosis and identifying these things, what you're doing with spinal decompression significantly improves it, because there's nowhere in the market right now where I can go anywhere, I don't believe, that shows that spinal decompression actually assists with the recovery of spinal instability. I don't know. I've never looked at it, but So if you have a spinal decompression unit, you would be actually more of an expert than I would be on it, right? But what I'm saying is that title is very open for you if you want it. Now, with that title, can you get medical referrals? Yes. Because now what you're saying is, look, we can accurately diagnose this. I said you had to do two things. You had to accurately diagnose it. That's first and foremost. If you can't diagnose a condition accurately, the patient does not have a great chance of a full recovery, no matter what condition you're talking about. You look at any condition in the world today, if the doctor who's working with the patient does not have a complete diagnosis of that condition, the results aren't going to be as good. So that's why it can be so lucrative for you. Have you considered offering your program as part of your program as a continuing education course, perhaps similar to a diplomate program? Yeah, we looked into it a little tiny bit, and quite frankly, I don't have the time or the energy or the desire to go through all the hoops and bells and whistles to do that. So, you know, there's only so much I can do in a day. So I just have never wanted that. Because there's a lot that you have to go through with that. And so I've had approaches, and I've been approached by the American Chiropractic Association via another group to put my part of a program together for part of a certification program that they're looking at offering in spinal whiplash injuries. So, you know, yeah, other providers will take my information and they'll put it into that. And it could be you. All right, any other questions on it? The biggest thing to do is you have to have your basics in. It's like anything else. You have to be able to basically do what I just said that you can do. And then you just have to simply go out and talk to these medical providers. You have to go out and communicate, but you have to communicate from the point. What makes it a lot easier is if you truly believe and you truly know that this is the absolute best thing for those patients, you will have no problem. You'd have absolutely zero problem going in and talking to them. And if you don't feel that way, you got to get rid of whatever it is that's getting in your way of doing that, of being able to provide that, because that's what the market needs. Those two things, accurate diagnosis leading to great results. That's what the market really needs today. Some of the largest companies in the world are putting together their own health companies, so to speak, to manage their injured workers and their employees because they can't afford the costs anymore. So they think that they can do it better. And they're looking for, as that opens up, when I said this is like Bitcoin, as that opens up, for some providers, you are going to have an opportunity that to go on the ride of getting picked up. Of being either on lists of preferred providers for certain conditions by employers. Because you're that, listen, if an employer can actually send a patient to you that has a low back problem, a lot of calculators today calculate low back injury at starting at about 50,000. So if they could send it out to you for 10,000, they can save 40,000. Okay, that's what the market is looking for right now. Now, it's organizing, and it's organizing in a really interesting way in the fact that what it's looking for now is results, and it really doesn't care about how it gets the results. But you also have to remember, doctors, that anybody that's looking to incorporate doctors into a system has to be able to scale. And part of the problem that has been traditionally inherent in chiropractic is that all chiropractors do things a little differently. So it's very difficult to scale. You go to physical therapists, they do it pretty standard. And you have large, you know, you have companies that own 3,000 clinics that can actually go, okay, this is the way we're doing it. Whereas chiropractic is more individual to individual to individual. So the thing that makes it hard to scale is that there are not enough doctors that know how to do what I'm just saying here in this program. So it's pretty key. And if you can do it, you will find the benefits in the market because they're everywhere. Okay, I don't see any further questions, doctors. I really appreciate your time. Again, we do these Try to do these twice a month, and I try to keep them short and right, brief to the point. So I hope you gleaned something that you could use today. I thank you very much for your time, and you have a great week.